Welcome to a Reddit Bytes production, the best Reddit channel on YouTube. If you subscribe right now, I will give you a cookie. If you don't, that's cool too. Enjoy the show. Today's Ask Reddit post. Autopsy Doctors of Reddit. What was the biggest revelation you had to a person's death after you carried out the procedure? Worked at an animal hospital. They did necropsies for zoos all the time. An alligator died, and they shipped it to the hospital, refrigerated etc to stop the decay. They took it out and put it up on the table. After doing all the paperwork, they started opening up the alligator. After the first cut, the alligator opened its eyes. Turns out it wasn't dead. The zoo vet mistook an illness for death and the low temperature put it basically into a coma. Edit. Unfortunately, this is all the information I know on this story. It's been 7 years since I worked at that place. I worked at a coroner's office for a while, and once we had a guy who we thought had died from an OD on meth. Well, we started the autopsy and I went to cut his lungs out and blueberry muffin mix started coming out of them. I stuck my finger in his mouth and it was full of blueberry muffin mix, and it was in throat. Turns out he got just high enough to pass out while eating the muffin mix and he ended up choking to death. I did the autopsy of both a robber and his victim. The robber shot the victim in the back when he tried to escape in a motorcycle, and the robber was shot by the police in the exact same situation. What's interesting is that they both died by exactly the same lesion. Both of them had their fourth lumbar vertebra shattered and their aorta, main artery of the body, sectioned at the same level. I thought of it like an extreme example of instant karma. During my internship rotation a couple of years back, a 40-year-old guy came in because he suddenly collapsed while drinking with friends. He came in unresponsive, mouth bleeding, and not breathing, so we had to intubate him. For some reason, the endotracheal tube, the stiff tube placed inside the trachea to help the patient breathe, won't go in, but we managed to suction copious amounts of blood clots. After CPR, still with unsuccessful intubation, so we had to bag him with a face mask. The patient was declared dead and diagnosed with a ruptured abdominal aortic aneurysm. During the autopsy, they found out that the guy was apparently shot by a gun from the top of the head. The entry wound was obscured by his hair and was barely bleeding at all, and the bullet somehow went through the back of the guy's throat and made a hole behind the base of the tongue, which the endotracheal tube kept slipping into. Training in the medical examiner's office. Elderly woman found dead by herself in her home. There was nothing suspicious, so I was given the case. Took out all the organs, dissected everything. Completely unremarkable. I cut through the larynx as the last step before I could clean up and finish the case, and boom, giant piece of chicken lodged in her windpipe. Died choking on dinner. As a student in the medical field, I had the opportunity to visit a cadaver lab. I was very surprised to see how many people had died from choking. Out of the 12 or so cadavers in the lab that day, at least 7 or 8 were from choking. I went home and immediately looked up how to perform self-Heimlich. Not a doctor, but a whole body scientific donation technician. I'm the person who dissects cadavers after they were donated. We very commonly would get young cases, normally overdoses. Had a mid-30s female, went to medical examiner prior to donation, but they only did an external evaluation. I went to check her genitals to see if I could palpate a uterus. Found a condom full of pills. Similar to most, the body became a crime scene and we couldn't touch her. When we finally were able to continue, they asked us to photograph the pills to send to the examiner's office. They were mostly Advil and Zytec. Easily one of the weirdest things I've ever found. 6 months after my aunt's passing in a drunk driving incident, the coroner decided to ring up my mum and inform her that they completed their report on her passing and deemed the likelihood of suicidal intentions which may have factored into said incident. I initially didn't understand how coroners could deduce such a thing, until I remembered. Self-harm scars are a thing. My mum had only just gotten to the acceptance stage of grief, and it put her firmly back to square one. She's fine now. When my parents were in medical school, they attended an autopsy of a patient who had died in a car accident. Autopsy revealed that apparently this guy had survived a chest shot in Vietnam years ago that the surgeon's medics left in rather than perform risky surgery. The accident had migrated the bullet to his heart and was ruled the cause of death. Med student almost graduated here. A couple years ago I attended the pathological anatomy course, and during a class the professor showed us some autopsies. Despite the tremendous smell of 4/5 consecutive autopsies, one of them was carried out on a homeless patient that died in the year probably due to heart failure. The body had massive ascites, flared in the abdomen, so at first he had to evacuate it. Imagine him cutting the abdomen and the yellow rancid liquid started to come out like a fountain. One of my colleagues fainted. Then the next step was to examine the abdominal organs. Imagine the face of every person in the room when it became clear that the patient had some form of inherited polycystic disease and the liver and the kidneys were full of cysts. The liver weighted more than 10 kilograms, normal weight 2-3 kg, and the kidneys almost 3 kilograms each, normally 150 grams each. The professor was really shocked at the beginning, but then he really enjoyed cutting through the cysts in order to get samples. They popped like airballs, spreading liquid all over the place. Second colleague fainted. The other ones were pretty standard, but I think I will remember forever this one. In particular that liver on the scale. I even took a picture but I can't find it anymore. PS I'm sorry for any mistakes but I'm not a native English speaker. This story circulates every year at my medical school. A body came in with a gunshot wound to the chest. There was no exit wound. They tried to locate the bullet during the autopsy. No success. They then did a whole scan, X-ray or CT of the upper chest, abdomen, pelvis. No bullet. At that point someone said FCK it, let's scan the whole body. Lo and behold the bullet was detected in the popliteal fossa, area behind the knee. It had embolized, traveled from the heart all the way down the arterial system to the knee where it got stuck in one of the narrower blood vessels. Forensic pathologist here. Two come to mind. I had just moved back to my home state where family lives. Get a case with a man with a distinctive last name in the family tree. I put a text out to my mom to see if we were related, but before she texted back I pulled the sheet back and already knew. He looked like me. It was my great uncle. Get a case where it's a house fire death. On exam he's got multiple textbook stab and incised wounds. I spend the next 30 minutes getting gaslighted, quizzed by PD about are you sure? Because they thought this was a straightforward house fire. Unfun fact, fire's not an uncommon way for people to try to conceal a homicide. Former homicide detective here. Suspicious death. 30-ish male found alone by cleaning staff in the back row of a sparsely attended sci-fi movie. Strange scratching wounds around in mouth. Some pitchy in eyes and on cheeks, but no signs of strangulation. No obvious signs of chronic illness or disease. Presented as healthy, normal adult male. Found on his person was a wallet with normal contents and a single cancelled movie ticket, indicating he went alone. Weird, spy movie shit going on here. Autopsy. A large amount of popcorn compacted in his esophagus, like a half cup. Dude was apparently excited by the movie, stuffing popcorn in his mouth, and choked. The scratch marks around in his mouth were self-inflicted, trying to dig out popcorn. Verified via fingernail scrapings. His was only DNA present. Loud movie. He was in the back. No one saw or heard him choke. I've never eaten popcorn again. I was an investigator for a state medical examiner for just over 2 years. Had a mom that had drank herself to death according to the husband after relapsing on Mother's Day weekend. I just felt like something was off. Sent her for an autopsy. Had a ruptured liver where dude had essentially beat her till she internally bled to death. Later, while out on bail, he stole a semi-truck, crashed it in a pond, got out shooting at a deputy, and they killed him. Saved the taxpayers a good chunk of money. My grandmother had a massive stroke in her 30s that paralyzed her entire left side and died in her 60s from a heart attack. But while doing the autopsy they found out she had bad lung cancer, but she never had any pain from it because it was in her left lung. She was a very heavy smoker, so it made sense. It's just crazy that she had lung cancer and never knew. So I'm not an autopsy doctor or anything of the sort. I did sit in on a murder trial. The mom drowned her infant in hot water. She claimed she was giving her newborn a bath in the sink with one of those sling type inserts so babies can't go under. The doorbell rang. She answered and came back to her kid in scalding hot water. She claimed the kid had somehow turned on the hot water and burned himself while she was answering the door, but drowning was the ultimate rule of death. In the autopsy photos, the most disturbing thing I've ever seen in real life is you could clearly make out hand marks on that poor child's skin. On his biceps, you could see the finger outlines like you do if someone slaps you. I was 18 years old taking a criminal justice class. Just the ease of watching the trail and her nonchalance killed most faith I had in humanity at the time. I know this doesn't quite fit the question, but for years I saw that boy's face in my sleep. What really kills me is despite the evidence she got off. My wife is a pathologist assistant and during her schooling carried out the autopsy of a newborn that died minutes after birth. The mother was desperate for a child and had a history of multiple miscarriages at different terms. This was her first time making it full term and all prenatal checkups revealed no problems. The delivery was difficult, but successful, and baby was alive for a short time. Skip to autopsy. All signs point to baby being fully developed. Get to the abdominal cavity and the liver is lacerated and hemorrhage everywhere. During the difficult delivery, the resident used too much force with the forceps to pull the baby out. The ruptured liver that caused the baby to bleed out internally. Wife was enthusiastic about autopsy up to this point. Now has no interest. Sheep farmer. I have to know how to do a necropsy for when something dies to know if it's something that could spread. How do you fall over dead after losing a ton of weight and after treating her for everything under the sun? She would gasp for air and struggle to breathe, but antibiotics, steroids and anti-inflammatory drugs didn't touch it. She finally passed away and I cut her open to see what the hell happened, fully expecting to see her lungs riddled with shit. Her heart was 5 times the normal size and hard as a river stone. My guess is she'd had that issue her whole life and it didn't kill her until she was 2. Masters in forensic pathology here. You'd be surprised to know the number of people that have life-threatening issues that never went diagnosed and that they didn't die from. Seen an older guy who died of pneumonia in hospital. On autopsy, the guy had both an enlarged heart and a couple of medium-sized aneurysms in the brain. Another guy in his 70s apparently came into the ER and had chest pain, then died shortly after. Dies of a heart attack but also had cancer. In less natural circumstances though. Saw a guy who had been shot in the head a couple of times. 3 definite entries and a blown out skull, but police only found 1 bullet. Couldn't find the other bullet in his head at all. Assumed the police missed it. Went on as normal with the autopsy until we got to the chest cavity. The other bullet was just chilling beside his lung. Turns out it entered the skull, hit the inside, ricocheted down his neck and into the chest. That was pretty wild. I was in charge of making copies of all evidence to be used in the trial of Donald Harvey in 1989. He was known as the Angel of Death. One bit of evidence was an autopsy photo of an exhumed elderly woman. The examiner was holding with tweezers an 18 inches piece of cotton being pulled from her throat. Harvey liked to stuff cotton so far down into the victim's throat that it could not be seen. I still can't shake the image from my brain. During medical school I did a forensic pathology rotation during 4th year. Had an autopsy on a woman found in her burned out home. She was on home oxygen and the fire started in her bedroom. There were also liquor bottles around the home, so the thought was maybe she was drunk, smoking in bed, and caught herself on fire. She was badly charred up on the outside with no real distinguishing characteristics I could see. We opened her up and when we got to her lungs they were just the prettiest pink you could imagine. Just like in the textbooks. This means she wasn't alive to breathe in the smoke and soot from the fire, so she had died. Spoiler, was murdered before it was set. Ultimately I read in the paper some weeks later it was the boyfriend trying to get insurance money. My dad used to perform autopsies. His best story was that they were brought a body that has no real indication of any issues. After examining the body, the only thing of note was that there was blood coming out of the guy's rectum. They begin the autopsy and the guy's organs are completely liquefied and the body cavity is filled with lead shot. It became apparent really quickly that someone had shoved a shotgun up his ass and pulled the trigger. This was in the 70s and I still have to wonder what this guy did to piss someone off enough to get a shotgun up his ass. Not mine, but a doctor I used to work with. Back when he was in school, he would do his cadaver labs really late at night, to many people during the day. One time it was really late, around 2 AM. He was listening to his lecture on his headphones and he saw the cadaver's arm move twitch. He thought it was just his mind playing tricks on him. Then he saw it again, proceeded to run away in a panic. He told a few of his classmates what happened but nobody believed him. Next day they had a group cadaver lab with the same cadaver. The arm twitched yet again. The professor did some digging and it turns out the patient's pacemaker was still fully functional and occasionally fired, causing the arm twitch. He was so relieved, he thought there was a zombie in there. Medical examiner here. This probably isn't a big wow revelation, but it certainly made an impact on me. Very early in my career, I did an exam on another doctor who worked at the hospital where I trained. I didn't know this gentleman personally but was acquainted with him by reputation. He was a very happy-go-lucky sort, much loved by everyone in his department. He died unexpectedly at a young age of what turned out to be a drug overdose on pharmaceuticals he had been diverting from the hospital. I don't think anybody saw that coming. myself included. It was a lesson to me that anybody can fall victim to addiction, and that it's hard to know what anybody's private struggles are. Medical student here, and this story is from anatomy class. One of the cadavers in our class died of cancer, and when we took out the gentleman's liver it was very large and full of bumps all over. The liver itself was also hard as a rock. The poor man's cancer had spread all over his liver and was full of tumors. It really hit home that this was what cancer was like and demonstrated its pure destructive nature. My friend had to do an autopsy on a baby. The dad claimed she died after rolling off a couch. My friend found that the kid was slammed against a hard surface multiple times. Dad eventually admitted he hit the baby against the wall after she wouldn't stop crying. My friend had to quit that job cause it was so taxing mentally. I'm a med student, not a pathologist or coroner, but in anatomy lab the tank next to me had a donor with an inflatable PNS pump inside his SCRTM and shaft. It was completely self-contained. Fluid in the container and the SCRTM could be pumped into the shaft tube, creating an erection. Then the fluid would just be released back into the pump and the BNR would go away. Pretty wild. Not a doctor, but I did a necropsy on one of my birds a couple weeks ago. I couldn't tell how she died before it happened, but after opening her up I found about 14 masses of tissue in her reproductive system. At first I thought it was cancer from dissecting one of the masses. Later I found out it was actually an intestinal infection. Edit. It was actually a reproductive tract infection. Some of y'all were asking about the vulture that lives in my backyard named Randy, so I made Armanda the vulture. I am a pre-med student, and one time while shadowing a forensic pathologist, 3 days before Christmas, he was doing an autopsy on an automobile versus pedestrian accident. The man's face was completely smashed in. When they take samples of the brain they cut the skin, pull it over the face, and they cut off the top of the skull. When they did that the skull was basically shattered and bone fragments pulled back with the skin, and when they cut off the skull cap, the brain was obviously damaged and the eyeballs had been pushed back, fallen through the orbits and into the cranial cavity. The guy also had $10,000 in cash in his yarn pockets. According to police he had a record involving drugs, so the theory was either a drug deal gone bad or he stumbled into the road while under the influence. I'm a medical student, not a doctor, but when I dissected my cadaver in my first year, it had lots of surgical markings and was pretty overweight. After I'd been able to work through all the parts of the body with my group, we were able to piece together with our lab leader that our donor had been in and out of the hospital for a quadruple bypass, followed by a pacemaker, a stomach stapling, and then what looked like an emergency open heart surgery that she died during. Not a rare disease or strange occurrence per se, but it was interesting finding clues around the body as we learned anatomy. My friend once cremated a lady, and when they pulled the table out there were 3 sets of forceps sitting there. Most likely she died in surgery, but I always thought it was crazy those were left in, and whatever metal they're made of clearly has a higher melting point than cremation temps. Reading all this makes me paranoid that I have something wrong with my organs that I'm not aware of. I am not a pathologist, but when my father died from drowning, it was noted he had acute cirrhosis of the liver. The coroner also removed a bullet from between his heart and spine that Dad received in Vietnam. It was very degraded. He had also lost a thumb and several feet of intestine there, the evidence of which was noted in the report. Dad had served 22 years in the army, and he had been awarded the Purple Heart 3 times. He lived a hard life after, and it was speculated he would have passed soon of cirrhosis of the liver had he not drowned. Late to the party, but in university I applied and got into the presection lab. Basically, we got the fresh pickled cadaver and dissected it for the anatomy lab. We weren't told anything about his medical history or cause of death. List of things we found: metal fragments in his quad and calf sternum was wired together, old surgery, blood jelly in the brain, old school stent above the heart. There were other weird things. Mostly though I still struggle with the smell of pepperoni because it's so similar to embalmed corpse. Found that out after prosecuting for a few hours and then going to the cafeteria for pepperoni pizza and then vomiting said pepperoni pizza. I took forensic lectures, so I saw quite a bit of crazy shit, but the things that stick is an autopsy revealing a history of abuse, pain and violence. A little more funny, a skeleton was found in the near mountains. It was very clear he died in an accident 20 plus years ago. However, he had to be identified via DNA. Turned out his dad was not his dad, but his uncle. Sparked a whole public family drama show, cause the family was well known in my area. I'm a veterinarian and sometimes I do necropsy, basically autopsy for animals, and one of the more notable case involved a prized Wagyu cow that died mysteriously. Wagyu cows are very expensive to rear and fetch a good price at the slaughterhouse. After cutting her open, I found metal wires extending from her stomach into her heart. It's what we call hardware disease. Apparently the cow decided that eating metal wires for constructing fences was a good idea. Normally the farm hands are quite good at keeping these hazards away from the inquisitive bovines, but I guess slip up do happen from time to time. Not a doctor, but recently I was reading about Hiroshima and Nagasaki and one person's perspective. When their family member who experienced the disaster died many years later, they were cremated and left, and their ashes were tiny pieces of broken glass and metal from the initial explosions. Edit. Article here. It requires a subscription, but you should be able to read it because I put a after.com, like.com. Thanks you, but a surprise. I used to assist with wildlife necropsies for the state F&W department. Two come to mind. Someone shot an otherwise healthy looking deer and brought it in because they found something weird when they cut it open to gut it. Sure enough, there was a cantaloupe-sized sphere of tissue in its belly. It had thick, very smooth, slightly rubbery walls. The vet was pretty sure it was an abscess, but said it was the largest walled-off one she'd ever seen hole like this. Cut it open and, sure enough, the walls were about a 1/4 inch thick, and then it was just all pus. A meat cantaloupe filled with pudding thick pus. Also, we got a dead bat in, a little brown bat. They're tiny, and inside it was a dead, also fully formed bat fetus. Near term but without fur. It was almost a third of the size of the mom. Super cool. Edit. I found a picture of the pus cantaloupe. Enter at your own risk NSFL. https://imgur.com/a/ndchem3. Totally not related but somewhat related. My sister-in-law works in medicine, and one of her classes involved studying and dissecting cadavers. One day in class they wheeled in a body, and when they pulled back the sheet, a girl fainted when she realized it was her aunt. Not a forensic pathologist or ME, but I occasionally liaised with an office as part of local print media in the aughties. Many fascinating stories, but the one that stuck with me, no pun intended, was from an ME who discovered, while dissecting a man's heart, that he had killed himself by first heating peanut butter to a liquid and then injecting it. It reached his heart and clogged it up, and that's an image my brain still loves to dwell on now and then. I'm not a pathologist, but I work in a field adjacent to it. One patient was heart attack caused by cocaine use. The heart was apparently giant, like having to use cocaine just to keep the heart going. My dad used to be a pathologist assistant and had to quit after a teenage suicide around the age of my brother, then a couple or 3 SIDS cases, which is sudden infant death syndrome, in the same week. As someone who is waiting on autopsy results from the coroner on a loved one, I find this incredibly fascinating and frightening at the same time. I'm not a doctor, but my uncle, dad's only brother, died when he was 17 in a car accident. In 1975, they did an autopsy and told my grandparents he died on impact and didn't suffer. My dad personally knew the autopsy doctor, and he told him that he didn't die on impact. He suffered for a bit and had internal bleeding, and that's what ultimately caused his death. My dad hasn't and will never tell his parents. Bad accident during high school, missing scalp of young girl, coroner couldn't find it. My buddy worked at impound yard and found it embedded in broken windshield frame glass. Pretty gruesome. I'm a former police officer and attended several autopsies to record info for investigation files. One guy had been shot and killed, so the cause of death was pretty plain, but the pathologists doing the autopsy found a tumor the size of a walnut on his brainstem. He said the guy would have been dead in a few months even if he hadn't been shot. Another guy was dead due to a steak knife being stabbed through his heart by his wife. She claimed she grabbed the knife because she was scared he was going to kill her, and when he lunged at her the knife just went in. But when the doctor pointed out a half dozen or so marks that looked like freckles around the wound, he swabbed to develop a solution that clearly showed they were tiny little poke marks. I was able then to get her to confess that he was goading her. Go ahead, do it, until she hauled off and kebabbed him. It's not always like TV shows where the autopsy is the aha moment that solves a case, but sometimes it really is. not a doctor, but my family requested an autopsy of my grandfather so we could, hopefully, get some answers about how he died. Our family has a history of unusual medical conditions. Shout out to my ancestors who were massively inbred until 100 or so years ago, so we wanted to see what made him so sick leading up to his death. We never got a clear answer, unfortunately, but we did get an amazing summary of their findings. In the autopsy report, they listed all of my grandfather's body parts. Now, Papa was a large man. It stands to reason that his body parts would be a bit larger than the average guy. The list of body parts went something along the lines of heart, above average, liver, above average, brain, above average all the way down to testicles, average. I've never laughed harder at average sized testicles. Edit. Added at the because I don't grammar good sometimes. Disclaimer, not a pathologist. In anatomy lab in medical school, we found one of the cadavers had a PNS pump. There's a pump you squeeze in the SCRTM that pushes water, stored up in a hard plastic water balloon in the abdominal cavity, into a tube in the PNS. Other story I've told before, but I was dissecting the back of a knee when the knee implant, that I didn't know was there, popped out. For a brief, stupid moment I thought it was a Terminator and screeched. Bro, you actually watched the whole video. I'd give you a high five if I was a human. Make sure to click the like button and subscribe for more great content. See you next time.